Alrighty, we're gonna go ahead and get started. Like I said, I got a pretty busy evening with some questions and stuff that we've gotten submitted during our time with the other town halls and stuff. So first off, on behalf of the Paid Family and Medical Leave Insurance team, we just want to thank you all so much for being with us this evening for our third town hall for the Paid Family and Medical Leave Insurance program. We appreciate you really taking this evening to join us to help her offer some ideas, identify issues, make some suggestions, or raise any concerns that you may have relating to the program's development. Just a quick who we got with us today. We have members of our benefits work group, including Rick Heineken, Cameron Buzzle, and Robert Arnold. We also have Kelly Afani with our contributions in small employers work groups, and Caitlin Critton with our equivalent plans and self-employed work groups, Jason Bowley with our communications team, and then Lois Williams, Lily Hogue, and Leslie Chartier with the PFMLI leadership team. Brief rundown on how this evening's meeting is going to go. We're going to start with just a brief introduction on the PFMLI program by our policy manager, Lois Williams. And then Rick Heineken is going to provide just a quick update with regard to where the program is when it comes to benefits. Now, when Rick is done, we're going to go ahead and open this town hall for questions or comments. We did get a number of you that had sent us your questions in ahead of time before this town hall. We also had a number of benefit related questions that were asked during our two previous town halls on contributions and equivalent plans. So we're going to go ahead and address those questions first, and then we'll go ahead and move on to those that have been submitted during this meeting. Now, since this evening's session is intended to focus mostly on benefits, we may filter some questions related to other topics, but we're going to get to as many this evening as we possibly can. I would encourage you, though, if you have not done so, to go ahead and go back and watch our contributions and or our equivalent plans virtual town halls, as they may have some answers to some of the questions that you have. Those two town halls were recorded and they are posted on the PFMLI website under the town hall tab on our website. You can submit your questions, comments, concerns by using the Q&A tab there, the question and answer tab at the bottom of this screen. And please feel free to submit those anytime during this meeting. And then if you are listening by phone, you can go ahead and email your questions to paidfamilyandmedicalleave@oregon.gov. Now, just as we have done with the two prior town halls, we are going to record and are recording this virtual town hall, and it will be posted to the PFMLI webpage within a few days following this evening's event. Now, one thing I do want to emphasize is that because PFMLI, Paid Family and Medical Leave Insurance, is still very much in its early stages, and we're still developing it, there could be a lot of questions this evening that we just do not have the answers to at this time, and it could be a little time before we get those. We're really using this time to listen to you, gather questions, comments, or concerns that will help us build and implement a program that works for all Oregonians. We're keeping track of all of the questions that come in and all of those that have come in so that we can, work to identify answers to those. So again, thank you guys so much for coming with us this evening. And with that, I'm going to go ahead and turn this over to our policy manager, Lois Williams, who will provide just a brief overview of the PFMLI program. Lois?
Thank you, Dean. And thanks all of you for being here tonight. We're excited to hear from you. Your questions are going to help us identify areas that we need to delve into further in order to provide guidance over the next year to 2 years with better education and outreach. So I'm going to quickly provide an overview of the new program. Most countries around the world don't have paid family leave programs of any kind. Most programs around the world do have some kind of a program, but the United States is one of only a few countries that don't offer this type of leave at the national level. Oregon's Paid Family and Medical Leave Insurance Program was passed into law in 2019. Oregon is joining only 8 other states, plus Washington, D.C., in offering this type of a program. Of those other states that have paid family leave programs, 4 evolved from those states' existing disability insurance programs. Of the states with more recently enacted programs, Washington State and Washington, D.C.'s plans began paying benefits earlier this year. Massachusetts and Connecticut will each follow in the next couple of years, and then Oregon's program will start paying benefits beginning in January of 2023. When House Bill 2005 was passed in 2019, certain timelines were included in the legislation. The bill became effective in September 2019, and it requires that the Employment Department provide periodic reports back to the legislature on its implementation of the program at various stages. Other timelines that are included in the bill include that we are to have administrative rules adopted by September 2021, which is not that far away, it's only next September. Paid family medical leave contributions begin to be collected from both employers and employees in January of 2022. And then, as I mentioned, the benefits will be available beginning in January of 2023. The legislature funded the implementation of the program with a general fund loan, and that loan needs to be paid back to the general fund in January 2023. And then from that point forward, the program will be self-funded from the contributions into the Paid Family Medical Leave Fund. So the fund will pay not only benefits out, but it will cover the administrative costs as well. The Paid Family Medical Program really provides three types of leave. There's family leave, which provides paid time off to bond with a child during the first year after birth, adoption, or foster care placement, as well as to care for a family member who has a serious health condition. Medical leave is the second type of leave, and this is to provide paid time off for one's own serious health condition, the employee's serious health condition. And then there's safe leave, which provides paid time off to respond to issues relating to domestic violence, harassment, stalking, or sexual assault. And so here are a whole bunch of aspects of Oregon's program. Eligible employees will be able to take up to 12 weeks of paid leave in a year. They may take 2 more weeks of paid leave for pregnancy, childbirth, or related conditions. And then employees may take an additional 4 weeks of unpaid leave for events that are also covered under Oregon's Family Leave Act, also known as OFLA. The weekly benefit amount is based on an eligible employee's prior earnings from a base year or the alternate base year. So think about like last year, what was that base year? Those earnings will determine today's benefits or not, when the program goes live. Employees who made average earnings up to 65% of the state's average weekly wage will receive full wage replacement. Employees who made more than 65% of the state's average weekly wage will receive an additional amount, but benefits are capped at a maximum of 120% of the statewide average weekly wage. There's also a minimum benefit amount equal to 5% of the statewide average weekly wage. Several job protections are included in the program. For example, at the time that an employee returns from taking their paid leave time, they must be returned to an equivalent position. Also, their seniority is not affected by taking the leave. Also, employers may not discriminate against an employee who inquires about taking paid family leave or who actually does take paid family medical or safe leave. Employers must continue to provide health care benefits while the employee is out on paid leave. Now, I mentioned earlier, and I'll mention again here, both employers and employees will make contributions into the program beginning in January of 2022. Employee wages up to $132,900 per year starting out will be subject to contributions. That maximum amount is indexed for inflation each year. The contribution rate itself is going to be the same for all employers, and it will be set once each year by the Employment Department. It is capped at no more than 1% of wages. Of that maximum 1% rate, contributions are then split between employees who will pay 60% of the rate and employers who will pay 40% of the rate. Small employers, which are those who have fewer than 25 employees, do not have to pay the employer portion of the contributions, that 40% of up to 1%. More about small employers coming on the next slide. Now, employers can choose to have their own plan rather than participate in the state plan. If they choose that route, their plan must provide benefits that are at least equivalent to that of the state plan or better. Employers will have to have their plan approved in advance, and they will have to pay a fee of up to $250 to the department for the department to evaluate if their plan meets that equivalency standard. These employers and their employees do not pay contributions into the state plan, but instead they contribute to their own plan, and benefits for those employees are paid out under that employer's equivalent plan. We are currently working on administrative rules for situations where workers have more than one job. That can happen frequently. Sometimes people have 2 or even 3, 4 jobs. Each one could potentially have a different type of coverage. An employer who chooses to have an equivalent plan and maybe another job that participates in the state plan. We call those crossover situations, and we are in the process of identifying situations where we can provide additional guidance through administrative rules. On the prior slide, I mentioned that small employers, and again, those with less than 25 employees, can choose not to pay the employer's 40% share of the contribution. But if they do choose to pay that portion, they can apply for small employer assistance grants that can help offset the cost of hiring temporary replacement workers and other related costs, like overtime for other employees, while someone is out on leave. The grants are up to $3,000 each and can be requested for up to 10 employee leave occurrences per year. House Bill 2005, when it passed in 2019 to implement this program, included a requirement for the department to establish an advisory committee. Their role is to advise the director of the employment department on implementation, administration, and rulemaking for the new program. They consist of 9 members. They are our paid family medical leave director, who chairs the committee, and then 4 individuals who represent employee interests and 4 individuals who represent employer interests, one of which represents small employers. And this group has been meeting monthly for almost a year now. With the help of the advisory committee, we've established some additional work groups to help bring in even more perspectives as we start developing this program. The equivalent plans work group has begun discussing how that process is going to work for those employers who choose to go that route. How will the application process work, along with identifying processes for renewing each year, or if they choose to withdraw, what will the process be to withdraw, and possibly terminating an equivalent plan. They're also going to discuss what reporting processes those employers will be asked to do, and will help develop rules for when disputes arise between employees and employers who have those equivalent plans. The contributions work group is exploring who must make contributions, how to define wages, and how employers will report their information and submit the payments. They'll also take a look at areas involving the sale or transfer of a business and any interest and penalty issues. The small employers work group is determining how and when to count employees. Because remember, you have to have fewer than 25 to be a small employer. So how do you count employees, and when do you count employees? They are also beginning to develop the small employer assistance grant process. How will people apply for grants, and what will that process look like? This work group is also clarifying the job protection provisions I previously discussed that really affect all employees and employers regardless of size. And then another work group is the Self-Employed Independent Contractor Work Group. The paid family medical leave legislation allows self-employed individuals, again, they're not employees, they work for themselves, they have their own small businesses, they can elect coverage under the state's program. They must agree to participate for at least 3 years, and their contributions are based on their taxable income rather than wages. And this work group is exploring, what does that look like? How does that calculation work? And what is that process going to be looking like to elect coverage? And then the last group that we are talking about tonight is the benefits work group. And this group is working with everything from determining who's eligible for benefits, how does one apply for benefits when the time comes, what is the computation of benefits, and how is payment going to be made, as well as taking a look at the types of leave that qualify, and what if it's intermittent leave? For example, an employee doesn't need to take off 12 weeks in a row. Maybe they need to take off a couple days here each week, or periodically, intermittently. So this group is looking at those areas. And so I'm going to stop here, but before I turn this over to Rick for more details about the topic of benefits, I really want to thank you again for participating tonight. We are going to be capturing all of your input, whether we get to your questions tonight or not, but you'll also have additional opportunities to provide input. Very soon here, we're going to be starting to draft administrative rules, and we will post them on our Paid Family Medical Leave website so that very early in the process, people can take a look at the administrative rules. We will consider all of the input that we receive through that channel as well. Then later on, next spring and summer, we will be doing formal rulemaking, which is another opportunity for the public to make comments on these rules. So thank you for being here. We're happy to hear your question.
Thank you, Lois. Lois just provided us with a great overview of what PFMLI is and some of the requirements for benefits, and that's what I'm going to talk about a little bit tonight. Oregon's new law provides direction to us in implementing this new program, including the requirements for applying, eligibility, and qualifying leave purposes. Any eligible employee who earned $1,000 or more in earnings and has contributed to PFMLI in Oregon during the base year, and who has a qualifying purpose, should be able to receive benefits. While the statute does provide directions to our team, there's still a lot of policy work that needs to be done. We have started to work through some of our questions by developing a high-level process of how benefits applications would be submitted and processed. This allows us to divide up the work into several processes. This includes application of benefits, processing of benefits, claim reporting, claim ending, and appeals. Within each one of these processes, we're determining what the priorities of our work efforts are going to be. We've completed most of the work concerning the application process, and we're starting to identify that information that we're going to need from covered employees when we will need it and why we will need it. This includes decisions around the verification we'll need for qualifying leave purposes. While we're starting to get some of the policies dealing with while we are still working on some of the policies dealing with the application process, we've also started to look at the processing of claims. And that kind of brings us to what we're going to talk about tonight and what you see on the board in front of you. Some of our high priorities, our current priorities that we're currently working on, include determining what the benefit year is, looking at the qualifying purposes that you heard Lois talk about earlier with medical, family, and safe leave, as well as how we process those benefits and how we calculate the benefits. We also try to look and see what the verification required and the required documentation is going to be as well. Some of the priorities that we're starting to move towards right now is looking at the payment of benefits, how we're going to look at the concurrent usage of other leaves such as workers' comp and other kinds of leave like OFLA and FEMLA, how we're going to look at backdating of claims, and what a workday and work week is as well. That should move us into the last pieces that we're going to start to looking at in the processes. That's going to be the ending of claims, what continuing claims or multiple claims look like, as well as how we're going to retain the documents and how we're going to protect the documents that people give us, as well as eventually getting to how we're going to do the notification of benefits and how the appeals process works. Like the other feature teams that we've talked about, we've been working with a stakeholder work group. The benefits work group was launched back in August, and we've got members who are representing both employer and employee perspectives. Having this outside perspective from stakeholders really helps us identify and develop the policies that we're going to need to go forward with PFMLI in the future. I want to thank everybody for being on this call today. We're really looking forward to hearing from your thoughts, your input about this program, and we're hopefully going to be able to answer some questions for you as well right now. So thank you very much for being here. Dean?
Rick, thanks so much. Lois, thank you for providing the updates with regard to just the paid family and medical leave program, as well as where the work group is with regard to benefits. And so, Rick, with you being the benefits work group lead, these first 5 questions or so are really directed towards you, and then we have a couple others for other people. So, the first question that we had received was, how do you qualify for benefits?
Thank you very much. That's really the most important question. I talked about it in my presentation, and we've also heard Lois talk about it as well. In order to qualify, an employee needs to be working in Oregon. They need to have earned $1,000 or more in wages during their base year. And they have to have a need to take leave due to a qualifying purpose. And that's going to be a serious health condition, care for a family member with a serious health condition, bonding with a child, or taking safe leave.
Thank you, Rick. This question also for you. And this person wanted to inquire and then confirm how many weeks of benefits an employee who has a pregnancy leave with complications would be eligible for under the new law, and how many of these weeks are paid leave under the current regulations.
This is a very good question, but as I answer it, I want to make sure I warn everyone that this answer and a lot of other answers we give are really going to depend upon individual circumstances. So the initial benefit period for PFMLI is 12 weeks of paid leave, and that can be extended to 14 weeks of paid leave for limitations related to pregnancy, childbirth, or a related medical condition. If you've used PFMLI, an additional 4 weeks of unpaid leave is also available through Oregon Family and Medical Leave Act, or OFLA. So the total of paid and unpaid leaves really can't exceed 18 weeks. But once again, there's a lot of what ifs in that scenario.
And then kind of related, we had another question kind of related to that, and is, can you provide some information on how the 2 additional weeks of leave for pregnancy incapacitation is allotted?
Sure. We are still reviewing this part of the statute, so we don't know, or we do know that the additional 2 weeks is directly linked to pregnancy, childbirth, or related medical conditions, including but not limited to lactation. But we need to conduct a little more research and policy work to define what exactly this is going to entail.
And then another one being, will there be benefit maximums for high earners?
That's a good question. Yes, the statute sets the highest possible weekly benefit amount for the state plan at 120% of the state's average weekly wage. That can get a little complicated, but to give you an idea or an example, if PFMLI benefits were available today, that amount would be about $1,312.09 per week. But that is, of course, what it would be today.
And then we've gotten this, a number of times, and it's, how will this benefit be impacted by short-term disability programs, Oregon sick leave, and then vacation leave?
Yeah, thank you. Employers may permit an employee to use paid sick time, or vacation leave, or any other paid leave earned by the employee in addition to PFMLI benefits to bring the employee's wages back up to 100% of what their average weekly wage is, as calculated by PFMLI. Eligibility for workers' compensation or unemployment and benefits will disqualify an employee from receiving PFMLI benefits.
I thank you, Rick. This next question is going to be for Kelly. And Kelly, this person wanted to know, what are the job protections for an employee returning from leave?
Thank you, Dean. Well, as Lois mentioned at the beginning, Oregon's Paid and Family and Medical Leave Insurance Program provides protected leave for employees who have worked with their employer for at least 90 days. So after the period of leave, employees are entitled to be restored to the same position they held before taking leave. And if that position no longer exists, they shall be restored to an equivalent or a similar position. Employees also won't lose any benefits that they've accrued, such as seniority or pension rights. Employers are also required to maintain their employees' healthcare benefits during the periods of leave. And I think it's also important to note that employees are protected against discrimination or retaliation that's in connection with asking about or taking leave.
Kelly, thank you. Rick, back to you. If a resident of Oregon has a seriously ill family member living in another state, would the Oregon resident be eligible for benefits in order to care for that relative?
Thank you, Dean. Um, Paid leave may be taken to care for a family member in a different state, provided the employee satisfies all eligibility requirements for PFMLI. The location of the family member is not relevant.
Thank you, Rick. Another one for you is if an employee moves from one state with a PFML program to another state with a PFML program mid-year, how will eligibility rates and days taken be determined?
Well, we are still in the process of determining how eligibility might be impacted when someone who recently worked in Oregon moves out of state. Currently, there are no agreements in place between Oregon PFMLI and any other state paid and family medical leave programs that would allow for a transfer of employees' information or claim from one state to another. However, this is a topic that we really do want to look at as we go into the future.
Rick, this question for you, and very much with the environment that just the world is in right now. And would I qualify for paid family medical leave benefits if I have children in elementary school that are unable to attend in-person classes because of the COVID-19 pandemic?
Well, we're still working to determine some of the specifics around the type of events that do and do not qualify people for PFMLI benefits. A lack of childcare options alone would not qualify an individual for PFMLI, since it would not meet any of the descriptions for a qualifying purpose described in the statute. However, if the leave is taken to care for a family member with a serious health condition, then that situation may qualify someone for benefits.
Thank you, Rick. This one, a definition related question, and they were wondering, how do you define serious illness?
Well, the law references the definition for a serious health condition that OFLA uses. If something is a serious health condition under OFLA, then it will likely be a serious health condition for PFMLI. Generally, a serious health condition would be one that requires inpatient care by a medical provider, or that poses an imminent danger of death, or that requires constant care. This would also include an absence of work due to pregnancy.
Thank you, Rick. This next one, another question that's come up, a number of times, and this one is, how will benefits under PFMLI interact with unpaid leave under Oregon Family Leave Act, OFLA? Is the intent that if an employee has already used 16 weeks of OFLA, they will not have any paid leave under Oregon's PFMLI available?
Well, once again, like we said previously, we're still looking at exactly how PFMLI will interact with leave under OFLA. From our initial reading of the statute, a covered individual may still qualify for paid PFMLI benefits, even though they have used all of the unpaid OFLA leave which they're entitled. What we do know is that leave taken under PFMLI is intended to run concurrently with leave taken under OFLA and FEMLA when the purpose for leave is the same. Because there are some differences between these programs, including who is covered and which events are covered, it may not always be possible for that PFMLI leave to run concurrently with OFLA and FEMLA leave. But like I said, this is still something we're looking at and trying to figure out the policy for as well.
Rick, thank you so much. Kelly, this question for you, and this one actually came in from a couple different employers, and this was, they were wondering, I'm a Washington employer with employees that work intermittently in both Washington and Oregon. We are currently withholding premiums from our employees for payment to the Washington program. When the Oregon program starts, will we be required to withhold premiums for both programs for our employees' wages? Will there be any exemptions for Washington employees working in Oregon? So a two-part question there.
Thank you, Dean. So Oregon's program covers all employees that are working in Oregon. So contributions will need to be paid for all wages that are earned in Oregon. Wages that are paid for work done in another state may be included if that work done in the other state is incidental to the work that is performed in Oregon. But we're still considering how incidental is determined and what that really means, and also how intermittent work will be categorized for those who regularly work in both Oregon and another state. So this is something that we're still looking into. We don't have a lot of details on right now. We're also still looking at how the program does interact with other states. Clearly, there's a lot of interest in how the program will relate to the Washington program as well. We don't have a lot of answers now. We know that our focus is on the provisions that are in our law and ensuring that all employees working in Oregon are covered. But we also recognize that there's a lot of questions around this, and that it's very important for employers and employees to have clear guidance on the requirements for our program and how it will work. In particular, how that intermittent work or work outside of the state would be included and covered. So that's a priority and something we'll be sharing when we have more information.
Kelly, thanks so much. Rick, another kind of question on PFMLI and OFLA, and this person was wondering, there are many employees who will use OFLA intermittently in hourly increments. These employees will use a significant amount of OFLA and never be eligible for PFMLI. Can smaller increments of OFLA be aggregated, and once a full day is reached, that time then paid or at least deducted from the PFMLI entitlement?
That's a fantastic question, and one that we are still trying to answer. There's a significant difference in how PFMLI is written from OFLA when it comes to time increments. The PFMLI statute states that increments can be equivalent to one workday or one work week. There's nothing in the statute that directs us to aggregate or modify the leave taken. Because of these reasons, we have been trying to develop a logical policy for coordinating the leave.
All right, thanks. This one also directed towards you. And does paid family and medical leave insurance, does it replace the Oregon sick leave, or is it in addition to it?
Good question. PFMLI benefits will be in addition to Oregon sick leave law and will not replace it. Oregon sick leave law covers some situations that PFMLI would not cover, such as more minor medical issues. Oregon sick leave also replaces an employee's current wages, whereas PFMLI is an insurance program that calculates benefits in a different way. Employers can allow an employee to use sick time at the same time that they were taking PFMLI, as long as total benefits do not exceed 100% of the employee's average weekly wage, which is calculated by PFMLI.
Rick, another kind of PFMLI OFLA related question. And can an employee use OFLA leave forms as verification for PFMLI so that they don't have to complete multiple forms?
Well, this is something we're still taking a look at because we're still developing what the systems are going to look like and how we're going to take in forms. But because the programs are administered differently and have some different definitions, current employer verification forms for OFLA may not have all the information necessary for our PFMLI benefit program. However, we do hope to align as closely as possible to existing leave program verification requirements, and our goal is to make the application process as simple as possible for both employers and employees. So this is very important to us.
Rick, just a couple more for you. This one being, how often can an employee apply for PFMLI benefits?
Well, when an application is submitted and approved, a covered individual may be eligible to receive the maximum PFMLI benefits allowable for a 1-year period. If the individual uses all of their available PFMLI benefit weeks, they would not be eligible to file a new claim until their benefit year has ended. The best thing we can say about trying to make people understand this is that it's very similar in this regard to an unemployment insurance claim that lasts for a 1-year period of time.
Rick, last question that I have that had been submitted to us, and that is, if someone has a child in 2022, before the program has started paying benefits, will they be able to take leave in 2023 when benefits are available in order to bond with their child?
Thank you, Dean. A person can take time off for bonding with a child during the first year after the child is born. The same can be said for a child that arrives through adoption or foster care as well. So yes, depending upon when the child was born or placed during 2022, the employee may be able to claim PFMLI benefits in 2023 up to the child's first birthday or to the end of the first year of placement.
Rick, that's what I have for you that had been submitted. So thanks so much for that, and Kelly as well for the several that did come to you. So I'm going to go ahead and turn this over to Lily Hogue, who is with our PFMLI leadership team. She's been monitoring all of the questions that you guys have submitted today so far in the tab, and you can go ahead and continue to submit those again with that Q&A tab there at the bottom of your screen. Lily?
Hi, good evening, everyone. So I've been reading your questions and I'm going to read them out. And actually, the first couple are for Lois. So these are questions actually about Washington or other states that have programs. Some folks are asking the first, there's kind of two in a row. The first one is that the state of Washington has implemented a similar plan. Are we consulting with them on plan design and implementation? Can we learn anything from our neighbors? What are we doing to not reinvent the wheel?
Boy, that is a great question. We are in contact with our Washington counterparts. They have been very, very forthcoming with their lessons learned. What they had to bring up their program also in a very aggressive timeline, get a lot of policies established, a lot of rules, build a system. They did a lot in a short period of time. And so they have been very generous with spending a little bit of time with us virtually like this, where we have sent questions to them in advance. They have shared documents with us. And so that's an ongoing relationship that we have, mostly about how they brought their program up. As Kelly mentioned earlier, we haven't gotten to the part about how do we talk about whether our programs overlap at all, or what can we do being bordering states, but that will come. That will come because they have been very, very forthcoming in offering us assistance.
And this is kind of a follow-up. We actually have a couple questions about this. We hear Washington had a backlog when they started and still does. Can we talk about what we're doing to avoid that issue when our program gets up and running?
Fair question. And I think Washington would say several factors were at play. They anticipated a certain number of claims would come in during the first year, and so they staffed according to that. But right away, they had what I would call a backlog of claims. Some of those were from the situation that Dean asked a question about earlier, where people who had had a child or adopted a child, had a foster child during the year leading up to when claims went live, now wanted to and qualified to take leave starting on January 1st. So that was a portion of it. Additionally, some people wanted to pre-approve their upcoming planned leave. Some situations, such as having a baby, you can plan ahead for, and so people wanted to get their claims in advance. And then at the same time, the COVID pandemic hit, and those people who had a serious health condition or had a family member with a serious health condition could now qualify for paid family medical leave too. But all of that came together at the same time, and their projections were too low. They didn't anticipate the high need. So they quickly added more staff and have slowly brought the backlog down, I believe, to where they wouldn't consider it a backlog at this time. But they have been sharing their experience with us.
Lucky in that way. And in 2023, when folks are able to access benefits, we hope to not have a backlog. I have another
That's right.
question
We really are trying to learn from their experience.
I have another question for you, Lois.
Mhm.
So somebody's asking, will the PFMLI benefit payments need to be reported on an employee's W-2, or will 1099 forms be issued? They're not sure if this has been covered, but will the premium deduction amounts be reported on their W-2 to show employee contributions in case they've worked for more than one employer? How will that work?
Well, anything that comes out of an employee's paycheck ought to be at least reflected on pay stubs and then summarized for the year. I don't know if it will show up on a W-2. That's a really good question. But that amount will be considered a year-to-date subtraction that comes out of someone's paycheck, so it ought to be reflected on a pay stub. When the benefits are paid out from the state plan, those are not coming from the employer. Those are coming from the Department of Employment. And so we haven't talked yet about if that will be a 1099 because we haven't really talked about the taxability of those. This is wage replacement, but that really is a federal law issue. So we know that's on our list of things to address, but we haven't gotten there yet. But there will be some kind of reporting, yes, reporting from the employment department to claimants who have received benefits so that they know how much they received at the end of the year or at some point during that year.
Rick, the next one's for you. So a key component of the PFMLI program is providing coverage for all Oregon families, including those with diverse family structures. How is our agency ensuring that individuals will be able to access leave without a burdensome and complicated familial verification process?
That's a very good question. We have been working with this policy within our groups and with our work groups to figure out how we're going to define that. Within the statute, it does say that that PFMLI, that caring for an individual is with a family relationship. They list out a lot of different family relationships and also state that if you have a relationship with an individual, as long as you have the affinity, which is like that of a family member. Because of that language and because of our reading into it, we are really taking that to be up to the claimant themselves, up to the covered individuals themselves, for them to attest that that is the relationship that they have. That is the policy that we're looking at right now. So it really is going to be on the individual themselves to attest that the individual that they're going to be caring for is somebody that they see as a close family member.
I have a couple more for you. The first one is, are formal notices due to employees before the program begins?
Can you repeat that question, please?
Are formal notices due to employees before the program begins? As in, what might employers have to tell employees about what the program is going to be?
Yes, that is part of the statute as it's written, is that employers must be informing their employees, and that's going to be part on the employees, and it's also going to be part of our program as well, is that we need to make sure that we are communicating that out to the public as well about what this program is, what it's going to entail, giving the employers the correct information that they can tell their employees, and providing information out to the state as well. Our goal is to really make sure that all employees know this as best they can, but it is going to be really on the employers to help spread the message for us.
So we have still some questions about kind of how OFLA, Oregon Family Leave Act, FMLA, which is our federal leave act, and paid family and medical leave will kind of work together. Could you just re-describe what you did in the beginning?
Well, like I was saying, this is all going to be, we're still figuring out how this is all going to work together. The main thing to remember is that the goal of the program is to make these different leaves work concurrently with each other. So if you are currently receiving PFMLI, you should maybe be on OFLA you should definitely be on OFLA from your employer at the same time. But if you have been receiving OFLA and not receiving PFMLI, at that point in time, it may not be working concurrently until you start receiving PFMLI. So it is still questions that we're trying to work out on how that's all going to work together. It's going to take a lot of conversations between us, employers, and the employees as we try to work it all together. The main goal is that if you are receiving PFMLI, or the main statement I want to say about that is, if you're receiving PFMLI, you must be running concurrently with OFLA. I think that answers your question.
Thank you. And I am actually going to ask this to myself, since it's in my area, but it's an important question that keeps coming up, which is, what outreach is the department planning to do to individuals who will be eligible for this benefit, but are not eligible for other benefits like UI, or might not know about all their benefits in general? So first, we're doing webinars such as these. Thank you all for being here. But we're also going to be putting on doing specific outreach to stakeholder groups for whom are generally like underrepresented in access to benefits. So folks who we think will likely need this the most, but may not know or have access to it. And we also had a question here about language and whether forms will be in other languages. Our plan is absolutely to do outreach in major languages that are spoken in Oregon, but also our website currently, if you go down to the bottom of our website, you can actually change it to, and I'm going to screw this up, I think it's one of 36 languages. Unfortunately, we haven't found a way through the back-end web browser. As you can tell, I'm very good at the internet. We haven't found a way to actually put that language change at the top of the website. So we are advising folks go down there and you can read all of our materials in language, but absolutely we will be doing targeted outreach to communities who will also want to use this program but may not know about it as of yet. We have a sort of a question about, I think this one actually again goes to Lois. So when there's a dispute between an employer and an employee about benefits or leave, what happens? Do they go to the state?
That's a great question. And it's going to depend a little bit on what type of a dispute it is. But our statute that we've been talking about tonight, it does include a provision that our department is to write a rule so that both employers and employees know what to do if there is a dispute. There could be a dispute between an employer and employee under the regular state plan, and some of those disputes will be handled through the Bureau of Labor and Industries as an unfair labor practice or a wage and hour claim, or they may come to the department and the department may make a decision and then there'll be an appeal process. Likewise, for employers who go the route of equivalent plans, they have a plan, they're paying benefits for their employees, and if those employees have a dispute about the way that that plan is being administered, maybe they think their benefits are not equivalent to what they would have gotten under the state plan, there will be a process in place spelling it out how they will handle that dispute. We don't have it in writing yet. We haven't defined it yet. We know that those same employees will also have some of the routes available through the Bureau of Labor and Industries. And we are working with that organization to determine where's the fine line between what types of disputes should the employment department handle and which types of disputes should BOLI handle. Which types of disputes should go back to the employer or the equivalent plan administrator. So there will be guidance provided, but we don't know what that guidance will be at this time. But we are working with both our internal administrative hearings section as well as BOLI to get there to where we can provide that kind of guidance.
Thank you. My next couple are for Rick. So Rick, where will medical certifications or information be sent and who designates the leave? Is it the state or the employer?
It's a very good question. We are currently really still looking at that verification process, but we are going to expect that the employer is going to be notified of the sick leave or the extended leave that the covered individual is going to be requesting, and they're going to have medical verification when they do that. So it's going to be up to the covered individual to provide that medical information to us. When we receive that, we are going to, of course, protect it with our own confidentiality rules as well, so that it's not going to be shared out. But it's going to be up to the covered individual to provide that to us, and they should be in contact with their own healthcare provider to provide that leave information for them. We will not be making the determination on what a serious health condition is. That is going to be up to the healthcare provider.
Thank you. And what, can you walk us through, well, first actually a short question, does PFMLI apply to public employers?
That is a very good question. And it provides, it is for public employers, and that's actually going to be one of those questions of the contributions and who eligibility is going to be covering. But it is going to be available for anybody who is working for a private employer, for state government, for federal government. Well, It's not going to be available for federal government. It will be for state government. So it is going to be available for public. I had to run through it in my head there for a second. Apologize for that. Had to run through the list of the different levels. Once again, it's going to really be focused on if you are working for a employer either based in Oregon or who works in Oregon. And we're still trying to figure some of that out as well. But if it's an employer that works in the state of Oregon, then it's going to be yes. The only exception really is going to be the federal governments. And of course, there is another what if scenario about the tribal governments as well and self-employment. So
thank you, which is that tribal governments and people who are self-employed will be able to opt into the program. And we, another question is, this is a great one. How long does the department estimate it will take to process an application and begin to pay out benefits?
It's a really good question, and we are not going to have an answer for that at this point, at this time. Of course, in the statute, I believe it is saying that it is 2 weeks, I believe. And now I'm on the spot and trying to remember exactly what the statute says. But there is an expectation that we have for paying out benefits once the application is filed. And that is, of course, the expectation that we're going to go for. Since we have not built the system yet, since we don't know what all of the processes are going to look like or how long it's going to work, we are not going to know that. Definitely, we want to make sure that as we design the system, we are going to design it so that we are going to be providing benefits as quickly as possible to those individuals who need it. So that's going to help determine a lot of our choices as we start to build the system. But since we haven't built it yet, since we're still developing the policies and the procedures, it's really hard for us to say how long it's going to be.
Thank you, Rick. And I'm going to ask a couple more questions and then pass it back to Dean. As you all can tell, we are in the process of getting your input and feedback on what we should be doing. The next one is for Lois. Lois, is BOLI going to change their eligibility requirements for OFLA and PFMLI? So folks are a little confused. So if eligibility for PFMLI is after earning $1,000, but OFLA requires 180 days of employment, and you have to have worked an average of 25 hours, how will that work together?
That's a great question because these are two separate laws. OFLA really provides time off for people who need time off, but it's unpaid time off. Paid family medical leave actually provides benefits during a time of leave to replace some of the employee's wages. So when they do overlap for the same qualifying purpose, Rick talked about this a few minutes ago, they really should run concurrently. But there's a lot of differences between those two laws. Generally, paid family medical is going to cover more workers, and they're going to provide better benefits because they're actually getting payments, not just time off. So they're getting some wage replacement payments. So paid family medical leave is going to apply to most all employers, even those with less than 25 employees. And currently, under OFLA law, small employers under 25 don't have to meet those provisions. So right there, there's a difference in which employers are covered or have to provide paid leave or unpaid leave, depending on how many employees they have. Many of the reasons for taking leave are going to be the same under both programs, but there are a lot of differences too. So for example, under OFLA, it includes sick child leave. If your child is sick with a non-serious condition, like they have a really bad cold or a broken leg, OFLA would allow you to take that time off to help care for them, but without pay. Paid family medical leave wouldn't even apply in that situation, only if it were a serious health condition. Rick made mention earlier too, they need inpatient care or if it's pregnancy related, it has to be pretty serious. Also, OFLA includes some reasons for taking leave that aren't even included in paid family medical leave, such as military family leave, if someone needs to take that time to spend a few days with a military member of the family, or bereavement leave. Those aren't in paid family medical leave, okay? So there's differences. Also, the qualifications are different. You mentioned the time frames that for OFLA, you have to have worked an average of 25 hours per week for 180 days in order to even qualify to take that unpaid leave time. But for paid family medical leave, there really is no time period that you have to work before being eligible to take the leave. There are other requirements, of course, but not a length of employment. So we are going to work with BOLI to try to, BOLI, the Bureau of Labor and Industries, and other agencies too, and others, to communicate those differences and those similarities. As Rick said earlier, where they overlap, they are required to run concurrently, but I've just listed off lots of different situations where they don't overlap, so they can't run concurrently. So we will have to work with the other organizations involved to put out charts and lists so that people can see which program applies to which situation and when they overlap.
Thank you. I have actually a last one, and this is a one that I want to ask Lois, last one for you. So what if an employee submits for leave with their employer and it's denied for being untimely? Could it potentially be approved in one state and not in another? Let's say they live in Washington, Oregon. Could they be approved for leave in one state and denied? Does one approval or denial override the other?
That's a great question, but it's really going to depend on the laws of each state. We're here administering Oregon's program. We'd have to look to see at Washington's program if that person even qualified for that. We're looking at people who primarily work in Oregon. If they're here working in Oregon, they're covered under this program, unless they work for the federal government or a tribal government that doesn't participate, or they're self-employed and haven't made an election. For all those other employers, if the employee's place of performance is within Oregon, then they are covered under this program. If the employer has an equivalent plan, again, it's for work in Oregon, so they are going to be covered. If they are also performing work in another state, the employer would have to determine if they're a part of that other state's program. Did they contribute to it? Are they required to? Have they met the employment eligibility? My own first assumption is that if you're primarily working in this state, this is the program that you're covered under. This is the program that you would apply for benefits through. If you are also working in another state, you would have to take a look at, did you meet the requirements of that program? And my guess would be probably not, because you were here working under this program. Did that answer the question?
Yes. And that is our final question of the evening for this particular town hall. Before I kick it back to Dean, I think, again, you'll see that we were really, really grateful for all your input. We do have a lot of questions about where folks can find this information and where our recordings will be. So Dean's going to let you all know how to find this later.
Lily, thanks so much. Again, great questions today. Really, really helps us here at the Paid Family and Medical Leave Insurance Program, work to implement, this program. And we just really can't thank you all so much for joining us this evening. It's truly going to help us build and implement a program that will benefit all Oregonians. Now, what people were wondering, today's benefits meeting, again, it was recorded just as the contributions as well as the small employer, as the equivalent plans of virtual town halls. Those were also recorded. So if you'd like to go back and watch this or those, share with a friend, another employer, employees, please feel free to do so. It will be posted on our Paid Family and Medical Leave Insurance webpage by the end of this week. There's a tab on the Paid Family and Medical Leave Insurance website that shows town halls. All of our recordings are under that tab. Our contributions recordings there, our equivalent plans, they've already been posted there. So if you missed those two town halls, please feel free, go check those out. They're going to be, again, under the town halls tab on the Oregon Paid Family and Medical Leave Insurance website. Now, we are always taking feedback. So if you think of another question, comment, concern regarding PFMLI, please do not hesitate to reach out. You can submit those at paidfamilyandmedicalleave@oregon.gov. Also, don't forget to sign up for our PFMLI updates. And also, again, this is our third of 5 scheduled town halls. So if you have not registered for our other town halls, please feel free to do so. Our next virtual town hall will be held next Tuesday on November 17th from 2 to 3 o'clock in the afternoon. Again, thank you all so much for coming and joining us this evening. And with that will conclude this evening's town hall on benefits. Thank you all so much again for coming and providing us all with the great questions and comments as we work to implement this program. Thank you so much.